So today we discuss the meningeal layers. The meningeal layers are the layers which covers the brain and spinal cord inside the cranium and vertebral column. The central system organs, the brain and spinal cord, both are covers within the inside of the cranium and vertebral column, covers the whole part of the brain and spinal cord. So these are the layers. 3 totally covers the brain and spinal cord and root of the nerves. So usually there are 3 layers. The outer layer is dura mater, the middle layer is arachnoid just below the dura mater, and innermost layer is pia mater. So the 3 layers: outer dura mater, middle is arachnoid mater, and innermost layer is pia mater. So these 3 layers covers the brain and spinal cord. So these 3 layers are called as meningeal layers. So usually these meningeal layers are related with the 3 spaces. The 3 spaces means the space between the 2 layers. So that are the important as a part of the clinical aspect. So the first one will come to the epidural space. What is this epidural space? The epidural phase is also called as extradural space. It is a potential space between the external layer of dura and the adjacent cranial bone. That means the space is a potential space that lies between the external layer of the dura mater and the adjacent cranial bone. So this space becomes apparent when bleeding takes place due to the rupture of meningeal vessels. That is called as epidural hemorrhage or hematoma. Then subdural space. The subdural space is that lies between the dura mater and the arachnoid mater. The superior cerebral veins passes through it, and if there is a rupture of these veins, cause the subdural hemorrhage. Then subarachnoid space. The subarachnoid space between the arachnoid and pia mater that contains the cerebrospinal fluid, the rupture of the cerebral arteries or their branches at the base of the brain, that causes the subarachnoid hemorrhage. So these 3 spaces, that is epidural, subdural, subarachnoid space, or clinical aspect is very important as in related to the meningeal part. So epidural hemorrhage, that is a hemorrhage in between the bone and external layer of the dura mater. So that is usually called as epidural hemorrhage.